With the winter months fast approaching, there are worries hospitals won't have enough staff to handle another possible surge. So here in Iowa, 26% of beds are currently filled, but there are less than 200 ICU beds available. Let's go to Local 5's Larissa Leone. And Larissa, you have been talking to these local hospitals and to service sending nurses to understaffed locations. What are you hearing about this tonight?
So as we know, COVID is still vastly circulating everywhere, and in 2020, hospitals and nursing homes were overwhelmed with COVID patients and COVID-related deaths. According to data provided by the CDC, COVID cases have surpassed the peaks we saw in 2020. But both hospitals and nursing homes tell me they saw in 2020 are very different. The problems that they saw in 2020 are very different from the problems they are facing now. I spoke with Dr. Kyle Ulveling, and he says it's important to remember the COVID challenges aren't over, and even if they were, hospitals would still be behind.
I can tell you in November of 2021, we have far fewer COVID admissions on a daily basis than we did 1 year ago. However, we have such a backlog of non-COVID critical illness that has been building up over the last several months that it was easier to get a patient to a tertiary care large hospital a year ago by far than it has been for the last 2 to 3 months.
Dr. Ulveling says that it is the easiest time to join the field of nursing as they are in high demand and hospitals right now need them more than ever. Hospitals are currently in normal staffing levels and are not using emergency staffing models. Normal staffing level is something Dr. Ulveling says stress does not mean that they are fully staffed. In the studio, Larissa Leone, Local 5 News, we are Iowa.
And Larissa, before you go, some people may be concerned that staffing shortages could close our emergency rooms. Does that mean there could be a lack of access for people?
Stephanie, Dr. Ulveling tells me that when hospitals close their ER, it doesn't mean that they won't service you if you come. It means they are temporarily redirecting ambulances to other facilities.
A lot of layers to this one. All right, Larissa, we thank you so much for that information. So let's take a deeper look now at COVID hospitalizations right here in Iowa. There are currently 544 patients in Iowa hospitals. The number of hospitalizations greatly differs when taking a look at the age of patients. So here's a breakdown of that. You can see there are less than 10 total hospitalizations for Iowans ages 1 to 19. From there, the difference is dramatic. 436 Iowans 40 and older are currently hospitalized. That's 80% of all COVID hospitalizations.
Although the highest risk are those people who are unvaccinated, we are seeing an increase in emergency department visits among adults age 65 and older, which are now again higher than they are for younger age groups.
The more alarming data is the number of Iowans in the hospital with a breakthrough case. 138 fully vaccinated Iowans are currently hospitalized. To put that in perspective, that's a quarter of all hospitalized patients in the state, but it's unclear how many of those patients may have underlying health conditions.